Good evening. Hi, Jeff.
Can you scroll through this real quick? I don't think I saw this. I know we talked ad nauseum about what we were doing, but I wanted to see what the agenda looked like real quick.
Sure. Oh, come on. Can you see it still?
Yeah. Okay. All right. That's what I thought. All right. Great. Okay. And did Adrian confirm that he was going to be able to join us?
Yes, he should be here. Katie can't make it, but Adrian.
Right. That's what I thought. Okay.
Yeah, sorry. I realized this weekend, I was like, oh my gosh, I didn't make the PowerPoint yet because we figured it all out, but I just
Right. That's all right. I mean, I knew that. I figured this was what we had going on. And you'll keep monitor the quorum for the minutes, because that's the only thing we have to vote on. Everything else is just discussion and pre. So there's no, if we don't get a quorum, or depending on how many people show up, we'll make that decision what we're going to do. There's Ray.
And we can always do the minutes at the next meeting. It's not a big deal.
Yeah. Yeah.
Hey, Ray.
Good afternoon, everyone.
Hey, Ray.
Is that your Monday voice?
Me? Yes. A Monday voice. I like that. I like that. I'm gonna have a Tuesday.
At least it was nice out today.
Yeah, it's still nice out today. It's beautiful.
I know.
out there.
Let's keep this thing to an hour.
There you go. Get yourself a walk in the daylight.
Yeah, because yesterday it didn't get dark before 6:30.
I know. Yeah. Yeah. Well, we do have it's a fairly light agenda depending on how long the Wilmington city conversation goes, defining that and how many people we have in the room. So, I mean, there is the possibility.
Of 6 o'clock, I don't think so.
What?
Everybody on this call has been working all day.
Yeah, I don't think we're gonna get to 6.
Yeah.
We'll get what we need done and then move on.
Yeah. So hey, Haley is Dr. Peoples and Katie are no, one is absent. Is it Katie?
Katie's unable to join. I was pretty sure Adrian said that.
I see Adrian just checking in now.
Okay, great.
Cool.
Yep. If I start talking, hit me up in the chat.
Dr. Peoples, hello.
Good afternoon.
Good afternoon.
It's good to be seen and heard.
Absolutely.
So Ray, what do you want to give it till like just another minute or so and then just get started? And we don't have any quorum business other than minutes approvals. So
Right, so we can come back around to that.
Yeah.
The way my screen is set up with this PowerPoint, I can only see like 5 people. Is Dr. Terry Lawler on yet?
Terry's on. Yep. And Matt's also present. So we also have the ability to move forward with that too. So everybody we need to have the meeting, I believe, is present right now.
Okay, so 2 minutes, let's rock and roll.
Okay. Sounds good.
Haley, how many people responded with the homework prior to?
I think it was just you and Dawn. And I put some of those responses into the slide so we can discuss them. And I know Tika was thinking about it. We talked a little bit on the phone today, but she didn't have time to type up a response.
Yeah, I have my responses. I mean, I have shortcut, cheating person's response, Adrian's gonna be like, well, you took the easy way out. I just went to the City of Wilmington website and pulled up the Wilmington neighborhoods map. I mean, I didn't know how to, I should have put the link in there, sent you the link, Haley, but we'll get to that.
Yeah, I
No
think,
problem.
I think consensus is all we're looking for. There is no right or wrong answer, just consensus, which may in and of itself be
That'll be a miracle.
a challenge either.
All right. All right, so we have only a few work group members here, but we have the folks we need to be present to kind of get started with the meeting. So let's see, we have, if you're a work group member, could you just signify your presence by firing your name into the chat, or if you're driving, just give a shout out. That way Haley will be able to mark people present. So if you're, again, if you're not talking, we do ask that you stay on mute. Continue to use the chat function for members of the public, while the work group will be the primary member speaking during the meeting. There is a public comment at the end, but if you're a member of the public and you have a thought you want to share, please don't hesitate to put it in the chat. We always try to circle back into those to discuss. And I think I'm frozen.
You're not frozen. We can see it here.
Okay, good. All right. So we do have meeting minutes to approve from last month, but we will hold on that until we have a quorum, or we'll just push it to next week.
So, excuse me, Jeff, would it be helpful for us to review the minutes, not to ask for an approval, but just to reground the conversation from the last time?
Yeah, I was thinking we would do that when we gave the dashboard. When we get to the agenda, maybe we can circle back, because the bulk of the meeting was talking about the data dashboard and collecting thoughts for Adrian and Katie to kind of digest. So yeah, I mean, if that's what you're referencing, you want to go ahead and take that and share any thoughts you had around the meeting from last time.
Now, I don't want to share thoughts, but I think it might be helpful at the appropriate time on the agenda to scan the minutes from the last time.
Yeah, I think that would probably fit for the brief the data dashboard update in my mind, if we're going to, that way we can maybe get more people in the room by we get to that point, just so everybody's here.
All right, so we'll hold until then. Thank you.
So we're going to get a quick update from Matt around the early learning seats and the wraparound services that were part of our recommendations last year, and that were part of the budget and that are being looked at currently. Matt has a higher level overview. We're going to get a real high level review of the street data webinar that DOE put together. Dr. Lawler is going to share with us her experience with that, and just kind of lay it out there as something that we should be considering as a data set or data point for the dashboard in some way, shape, or form, which will further complicate the meeting next month when Adrian and Katie present and share their findings. We'll give a quick update on the data dashboard, and then we're going to spend the bulk of our time, wherever that be, 30 to 40 minutes, talking around the definition of the City of Wilmington that this work group is going to be able to come up with. That's the overview of the meeting. So let's just jump right in to the first agenda item, and Matt, we'll turn it over to you to talk about pre-K and wraparound services update.
Can you hear me, Jeff? Okay, I apologize. My screen.
I think Matt just
You're
froze on us.
you're freezing.
See, I was looking at Matt and thought mine froze, so then it wasn't just me. Thank good. All right, I'm not losing my mind.
Program and the wraparound services programs that were funded in the budget last year have now been selected, and with respect to the pre-K programs are all up and running. And I believe that the wraparound services programs are now operational as well. And I think we talked about this at our last meeting, the pre-K programs for this current funding cycle are only expansions of part day to full day slots. So there were no new slots that were created because there were no providers who were interested in taking on new slots as opposed to providing a longer duration for existing slots. Some of the changes that we're hoping are going to be made in next year's RFPs should allow for both. The 3 schools that received the wraparound services grants through the competitive RFP process were Bancroft, Bayard, and Kumba Academy. So that's one piece of good news, which is that programs receive the money, are up and running, or helping kids. Second piece of good news is that the governor, in his proposed budget in January, recommended basically all the money that we had asked him to recommend for expansion of those programs in the next fiscal year. And has also recommended enough money of that to go into the operating budget that it should be possible for the Department of Education to put out multi-year RFPs for both of those programs, for the pre-K and for the wraparound services. And everyone who successfully bid on those programs in the last cycle indicated that that would make a huge difference in terms of what they were willing to do with respect to hiring staff, and just creating, longer term, more ambitious programs, knowing that that it was going to be ongoing money over multiple years and not just a one and done type situation. The to-do list, given all that good news, is that the Department of Education is interested in putting out those RFPs for both of those programs, the pre-K and the wraparound services, much earlier than it did last cycle. And in fact is interested in putting out the RFPs before the budget is passed, which it doesn't do unless the money is in the governor's proposed budget, which it now is. So on both fronts, we are trying to work to figure out what went the way we wanted it to and what didn't quite go the way we wanted it to with respect to the first round of RFPs, and suggest some refinements to how they do the next round to make sure that these programs carry out what we had envisioned when we first recommended the money. Ray and I have had an opportunity to have a couple of discussions with providers, and I know Dawn has been a very helpful participant in those discussions, as have some of the providers who actually received the grant funds. So we think we've gotten a pretty good sense from them of what we would need to do in order to incentivize providers to add new slots in addition to expanding the hours for existing slots. And likewise, we have had some discussions with the successful recipients of the wraparound services grants, and Tamara Smith, who had drafted the first, the recommendations that to our work group's original recommendation for those funds, is going to be contacting the folks who had helped with that first draft to try to incorporate some of the suggestions that were made, so that, as with the pre-K, we can see responses to the next round of RFPs that are even more in line with what we had hoped. But these are great problems to have. We're in terrific shape in terms of the money being there and the right people having input. We just need to work very hard over the next couple of months to make sure that we take full advantage of that, and that these RFPs generate the type of responses that will carry out the vision of the folks on this committee who put these recommendations together back in November of 2020.
Thanks, Matt. Appreciate it. Anything else, Matt, from your perspective, with the larger picture from Reading that you wanted to share, or anything else since you have the floor?
No, we're we've got some work to do.
Okay, great. Thanks. Ray, did you want to comment on that? Okay. All right, let's move on to the next next topic. Ray, did you want to tee up the street data and DDOE's data for truth action? Like what, just as a point of consideration for the work group as we move forward in our data conversation?
I'll let Dr. Terry Lawler speak to the workshop that we were invited to participate in.
Mhm.
It, it essentially really it promotes being more culturally grounded than just quantitative data. And I don't want to steal Dr. Lawler's thunder. So if you're
Okay.
ready, it's something that we absolutely should consider
Okay.
for the work that we're doing. So,
All right. Great.
Terry,
Sure. Thank you all for being able, inviting me to summarize this. For 2.5 years, Delaware Department of Ed has been a part of the Center for Social and Emotional Learning and School Safety's cohort. Initially, we were Kentucky, Michigan, Massachusetts, and Oregon. Massachusetts is no longer moving forward with us at this point. Our initial charge was looking specifically at strategic communications for social and emotional learning. And more recently, beginning in the fall, we have completed that initial project, and we've been focusing on data use under the theme of using data for truth and action. A number of states had expressed challenges with transparency in data use, but also just looking for ways to make our data efforts more equitable and humanizing. And so one of our first opportunities was last Monday, March 7th. And I invited you all because I know that our group is looking at building a data dashboard. And I thought the street data discussion might be a great way for us to begin that work or think about making that work more of a healing opportunity when using data. And so the street data authors are Shane Safer, Shane Safier, and Jamila Dugan. And the subtitle of the book is A Next Generation Model for Equity, Pedagogy, and School Transformation. And so what they propose is essentially flipping the dashboard discussion and looking more at qualitative data that is student focused. And they use the term that we would focus on data from the margins, essentially some of our overlooked places when it comes to looking for data. But their framework begins with holism, awareness, anti-racism, deep listening, agency, coherence, symmetry, vulnerability, and warm demander. And there are 4 steps that include equity, empathy interviews, really reaching out to community members and students to get a sense of how they feel they are represented in the data that's being used to make decisions. And then with that, using the information gathering process to plan more holistically for school transformation. So I thought it was a very revealing conversation. We will be having a book study this summer, among other books that we'll be looking at this summer. But if you're interested in learning more, would love to have your voices in those conversations. And a lot of our work, particularly in the Office of Equity and Innovation, we've had some recent changes, but a lot of our planning for the remainder of the year is around student voice and how we engage young people to hear their needs, but also support them in advocating for their needs, and as well as our shifting to meet their needs. And so you'll be hearing more about an upcoming summit for student voice in the summer. We also are engaging with some healing centered work from the Flourish Agenda. So a lot of opportunities for us to move from data collection to really how do we respond in ways that build agency and support for young people so that they can go on to ultimately thrive in school and in the community.
Thanks, Terry, for sharing that overview. And we'll be looking for the opportunity potentially for the book club, the book study. So when that comes out, please pass that along to Haley so we can share that with this group as well. But it was, this type of work was part of the original recommendation that we had made to the governor and to the full body consortium. So this does fit very timely and nicely with the conversation that we're having. So
And I don't have the dates yet for April,
Okay.
but the new book that was presented, the book's actually arrived today. It's by author Heather McGee, and the book is The Sum of Us: What Racism Costs Everyone and How We Can Prosper Together. So really looking at some policy as well as practice changes for transforming our data use.
great, that's good. Thank you for sharing that earlier, getting that email out to everybody, and we'll continue to put that out there for this group and see it move forward in our discussions, especially next month as we start talking a little bit more about where we are with what we compiled last month. So thank you. Ray, did you have anything else?
I thank you so much, Dr. Lawler, for the invitation. I can't tell you how important and how useful that workshop is, and I look forward to taking a deeper dive. I will be sharing with the group, and Haley, I'm not certain if I did. The Coalition of 100 Black Women released a series of briefs that are student first-person voice-centered Black girls ages 10 to 19 across the state of Delaware. And so I'm going to share that as an example of the methodology and really robust data that we were able to collect from, and of course, it's focused on Black girls because that's our primary audiences, are Black women and Black girls. So I'm going to share that as well. That's it for me.
Great. All right. Well, thank you for sharing that, Ray. Look forward to seeing that report or the qualitative data that your group was able to gather and draw some conclusions and see where we can involve that in our discussion. That said, our discussion last month, I think, is the next little update. Haley, if you could, to Ray's point, just to kind of refresh the room, if you have the agenda from the minutes from last month's meeting, just to kind of give everybody a high level idea where, I don't believe we have a quorum, correct? Okay.
Yeah, no, I don't think so.
Yeah, I don't count a quorum. So we take a look at the minutes. So we did have a great presentation from Representative Griffith regarding the suppression of explanation of benefits that really laid the groundwork for the reasoning why and the importance of that piece of legislation and ones that would be coming further down the pike. And then we obviously approved the minutes, and then where we really spent a large portion of our conversation was focusing on the 4 questions that we had been given in advance, and Katie and Adrian kind of facilitated our responses to this, and it was really a free-flowing brainstorming session. There were no guardrails, so to speak, if I can use Adrian's favorite line. There were no guardrails. We kind of just put all the ideas out there, no matter what we thought or what. We didn't try to solve anything. Correct, Adrian? We didn't solve a thing.
That's correct.
We did create a pile of work for Adrian and Katie. That's what we actually did. So if you can scroll through the questions, you can see we had a variety of questions, and then Haley took them and put them into a spreadsheet, and I don't know, somewhat organized them and sent them to Adrian and Katie, and literally got it maybe about a week or so ago. So it's not as easy as it seems, just identifying and tagging data, but Haley did a great job of compiling it. Now Katie and Adrian are taking a whack at trying to make some sense of it for us to come back and share with us in April, kind of where what we've shared and where we can go, and what's also out there. If I'm not mistaken, Adrian, you're going to also apply this to your knowledge of what data resources are out there in DOE, state, Katie also using Data Service Center to kind of trying to guide us into how we can get closer to the actualization of this data dashboard. Is that where we are with this, Adrian, did I summarize correctly where
I
you?
think, I think you summarized correctly. We do have, Haley, do you have the spreadsheet that I
Yeah,
sent
did
you?
you?
Yeah, I think I have, let's see where I saved your spreadsheet. I know I have mine. Yours is better to look at.
So while Haley searches for that, we did take a pass at reorganizing the information, and I think it's in a format that I think will be a little bit easier to digest. It'll be the basis for which Katie and I continue to do our work. And I wanted, if Haley can find it, I'm hoping to be able to have Haley share her screen, and I will talk through it. And then we will launch into that as well. But yes, no guardrails, still everything is dreamy, and we go from there. That's fantastic. Absolutely. So when you're ready, Dr. Venzer, we will launch into this.
So
Yeah.
we want to really dedicate the bulk of our time tonight to the city of Wilmington question. So Adrian, if you would just give a high level, like,
Sure.
explainer of how you organize the data, maybe that might be just helpful for this group. Like
Sure.
yeah, and then we can pin it and move to the bigger question about how we're going to define the city of Wilmington.
Sure, absolutely. So I took the data from the original spreadsheet that Haley did a great job of getting on paper or in electronic format from recordings and transcripts and chat. And we decided to organize it into what you see here. We have, I think, if you scroll all the way up to the top and then scroll all the way up over to the left. There we go, perfect. So we organized it into categories and subcategories, talked about the data presented, and then we added a few extra categories, a few extra columns to kind of help us formulate our thinking. So I think what we want to say here is that we've got major categories organized, and the beginning of those categories are highlighted in gold. So we've got academics, attendance, students, discipline, enrollment, educators, other opportunities, family, and I think we've got one map and health, and then unknown, right? And so we organized them into categories, and then we said, all right, subcategories. So if we scroll just up to academics, you can see academics is broken down into academic achievement, coursework, grades, graduation, dropout, and retention. And then we started to really get into, okay, well, what are you trying to present for these categories? We've got those listed. And then these new categories, these new columns represented by D and E are things that in our experience, we want to be able to look at. All right. So how are we summarizing the data, and are we comparing what we aggregate to something else? And so what you'll see here is, as we move to the right, there are lots of blanks. But with these data organized in this way, I believe that this committee, with our help, can actually populate these relatively straightforward. And with this organization, can actually add new rows if they think, okay, we want a new category or a new subcategory within a category, or if we want to measure something in addition to what we've got listed here, and again, begin to continue to germinate ideas. So that is the high level of what we have. I think we have something that makes a little bit more intuitive sense to people looking at it as they look from left to right. Admittedly, I only use Haley as my guinea pig and say, Haley, does this make any sense to you? And she was like, yes, but she is not the end all be all of the subcommittee. So we want to make sure that other people get a chance to look at it at some point. We do. Katie wants to weigh in a little bit as well to make sure that I haven't missed anything. And so that's what I'm waiting on before we unleash it on the committee with some instructions on how to continue to populate this moving forward. But we have taken a pass. The goal is to say we have taken a pass at organizing the data. We have taken a pass at populating the data. And yes, this is the organizational structure we will use moving forward. And we will begin to add additional columns such as, do we have this data? If we do not have this data, who has it? And how do we get a hold of it? And so on. So we'll just continue to expand upon this framework here. assuming that this framework is amenable and understandable for those who are going to be contributing to it. So we just want to give you an update that we have not just sat by idly. We have
No.
taken what you guys have done and made some steps forward, and we will continue to do so.
I think that this is great, Dr. Peebles. I mean, I think it is great that you guys have taken time to put some organizational structure to the brainstorming session that's going to help guide our conversation, and that you continue to come back and facilitate. And, you know, you and Katie, your time is appreciated. I know by myself and Ray, definitely, and I'm sure the work group members can attest to that. So thank you very much for getting this organized. And, you know, we'll look forward to next month where that's where the whole group will come back at it from the perspective of moving from left to right. I like the way you say that. Everything starts filling in left to right, then you know you're getting where you need to go. So that's great.
Absolutely. All right,
so-
so Haley, you can put the cover back on that now.
Yeah.
'Cause-
So the other question, Adrian, that you kind of teased us with last month that we ended the meeting with was this seemingly easy question, but you would, as the data analyst, and you would argue maybe not so easy. Like, how do we define the city of Wilmington? And that's basically our group. How should we be defining it? So do you want to, Haley, I don't know if the best way to do it is let Adrian kind of lead us to where we're headed based on the responses that we received, or is it better just to put the responses up and have Adrian kind of like go from there? I'm not really sure what's the best approach, or if there is even a best approach.
Maybe he could tee up why this is such an important question, because I think it came from Adrian, you know, how it's, you know, it sounds simple, but it's not. So maybe a little bit of background on that. And then we could review the feedback that people submitted and then have an open discussion about
Okay.
what people think.
All right, great. Sounds like a plan.
Sure. So at the last meeting, I took the pin out of this grenade and left. And the basis for this question is one that stems from a lot of data requests out of the Department of Education as people try to help communities, more specifically the city of Wilmington, and trying to do that in a way to provide services. But each time we were asked to help the city of Wilmington with the use of data, we were getting different definitions about what the city of Wilmington actually was, whether it was zip code based or neighborhood based or some other basis. We, of course, did our best to answer those questions in isolation, but I feel that for this group, it will be necessary to come to a common consensus definition of what the city of Wilmington is. And then, of course, all data analytics, dashboard, all services, all philosophies and ideologies, as well as action plans, will all have the same definition at its core, right? So this is not an exercise in complexity, right? I think everybody can come up with a definition of the city of Wilmington. I think this is an exercise in consensus, right? Can we get a city of Wilmington definition that we can agree upon and then use as the basis moving forward? We didn't find it easy in our office to try to come up with a definition. So I assume that there will be at least two definitions provided, and there may be more because not everybody answered the question at first. And then we'll have to try to figure out how to come up with a consensus as the basis for actions and planning moving forward. So that is the intro. We left it to the homework and we are now back.
So let's take a look at, we have we received some responses. I did just forward my simplistic response to Haley that, so we'll leave that one. She can figure out a way to add that in there at some point. So Haley, do you want to move to the slide with the responses?
Sure, I'll just tee up that this slide has responses and then the following slide has some other things that aren't City of Wilmington boundaries related, but just some other reflections that we got, so.
Okay. All right.
All right, so what we're looking at here seems like one is first bullet is geography based. The second one is voting based. It's still geology. It's still geography, but it's a little bit more nuanced. And then the third one has some other stipulations on it. I'm just trying to get a sense of what it is. Must include colonials, COW residents and programs.
So Adrian, a question for you, or
Yes.
perhaps the room. Is there a difference between the municipality as defined by the census and a voting and the election boundaries in terms of the exterior, maybe not the interior, it might be cut up a little differently, but like what draws the lines around it? Are they different? Or is that a question to kind of look at? I mean, is there a difference? I don't know.
I certainly don't know the answer to that question. Does anyone on the call?
Good afternoon. This is Darrell. Generally, your census tracts are different than voting districts.
Okay.
So the
Okay.
voting districts could be broken up by just the districts within the city. I know there are 11 distinct neighborhoods. I guess it ultimately depends on your perspective in terms of your purview of where you are and who you serve within the city. And
Okay.
probably with Adrian, why the department gets so many different requests depending on the requester.
Okay. Thanks, Darrell, for that. I
I
was
think
thinking
it's
that.
something, Jeff, that should be taken a look into because as we all know, there are Wilmington addresses that are not within the boundaries of the city of Wilmington.
Right.
So
So
there are distinctions.
I went to the City of Wilmington website, and there's literally a map that says the neighborhoods, the cities of Wilmington neighborhoods, and it has about 25 or 30 neighborhoods on it, but then it has a distinct line that draws like where they are, and they're like you're saying, Ray, they are what I would view as the City of Wilmington, not someone with a Wilmington address, because it's not within these. I don't know where the City of Wilmington drew their boundaries from, probably the municipality and the census tract, because it didn't appear to be a voting map the one I was looking at. But I can see where Darrell's point, it makes total sense. Like voting boundaries don't necessarily align to inside the city. They cross over to what I would say City of Wilmington residents that are not living within the city bounds. I don't know if that makes sense. This is what the point you're making, Adrian, like everybody kind of reads it a different way.
Is there from a higher level, is there a problem, a disadvantage, a challenge to using a strict geography-based approach to the city of Wilmington, i.e. limiting it to the 11 neighborhoods that Darrell mentioned that would be considered within the city of Wilmington, which I'm assuming those 11 neighborhoods don't necessarily map neatly to zip codes. So that's why I'm not mentioning zip codes. I'm talking strictly about neighborhoods at the moment. Is there a challenge with limiting the city of Wilmington for the purposes of the equity dashboard, for the purposes of other services that the Reading Consortium is concerned with limiting it to strict geography?
This is Ray. I'm not sure if this would be regarded as a challenge. If you could go to the next slide. So if we define the primary group that we really want to have much more information about as the students, then the students that reside in the city of Wilmington, however that's defined geographically, shouldn't be limited to where the location of the school is. Like for instance, somebody put in the chat about including Colonial. Well, those students reside in the city of Wilmington, but the schools that they attend are not in the city of Wilmington proper. So as long as we're not looking just at geography for data analysis.
Right, so Ray, would you be saying that a student who lives in Riverside, which is a colonial district community, they would be a part of this dashboard despite the fact that they don't attend a school within the city of Wilmington? Is that what you're saying? Or are you saying
Yes,
the
but
opposite?
they're residents, that they're, I guess the leading variable should be that they reside
Yes.
in the city of Wilmington, however, you know, whatever we
Ag-
find consensus around.
Agreed. Adrian, what I think a challenge that presents is there's no readily accessible switch you can grab that data and pull it out. Like if you have a school district, like it's not just the city of Wilmington, or you have private students who attend private school or different there's so many disparate data sources that by doing it the way you're describing it, collecting that data I would imagine would be a daunting task versus, all the kids who go to Colonial, pull the zip code out. You could easily sort zip code because you're not geotagged. So that is, to me, it's probably the ease of not doing it that way probably is at some point outweighed the tediousness of bringing all those pieces together from a pure geographic standpoint. Maybe, I don't know.
But if the student is the unit of analysis,
Yeah.
then the student that goes to a public school, whether it's a traditional public school or a public charter, has an identifying number.
Yep.
Yes, I see that too, Haley. Hold on just a second. So
Representative Williams. Oh yeah, her has her hand.
yes, Representative Williams, you have a question.
No, I just wanted to point out, I agree about the election districts doesn't necessarily define the city, but like I'm in the 19th district, so I'm not in the city of Wilmington, but there are EDs, so you could define them through the Department of Elections, through the ED that represents that representative district, if that makes sense.
What do you mean by ED?
Election district. So
Okay.
I have 12 in my district. Like for instance, Senator Lockman comes out to where I am in the suburbs, but her election district makes up of all these little individual election districts, her Senate district does. So some of those districts, election districts, are in the city and some are in the suburbs.
Okay.
You can pull them, the ones that represent the city.
So there's smaller sub districts within your larger district that if you carve them up, you could probably you would get a truer picture of the city of Wilmington versus
And
right.
you could get like an election, you could get a map from the Department of Elections and they have it all broken down so you could see it.
Okay.
It's just an idea.
It's a good idea. It's a good idea. And the visualization, I think, is going to help.
Yeah.
Dr. Menzer, to your point, I don't think we should, again, this is pie in the sky, this is big dreams. Don't limit yourself by thinking about how challenging it's going to be to draw a map of the city of Wilmington and then get the students in it, right? That can be done. It will be painful, but it can be done.
Agreed. I just think about like why it has, I was trying to answer your question probably as to why it hasn't been done previously or what has been the roadblock to it previously. That's why we exist. I think Ray's point is well made. Like if a student lives in the city of Wilmington and they go to a school and get an education, public education, charter or whatever it may be, we have to be able to put them in the bucket with everybody from the city of Wilmington and then be able to look, how are they doing relative to their counterparts in the county as well as within the city by where they live in the city. I agree with you.
Yeah. So I think that'll be, if you do geography based, which I'm hearing consent, I'm hearing people lean towards geography is the way to do this. Visualizing it will be key, but
Yeah.
doing this strictly by geography is one way to do it. There will always be people right on the boundary,
Always.
of your
There'll be
geography,
streets. There'll be
right?
streets right down the middle.
right? And so
Yep.
we just need to be prepared for that. If we get our City of Wilmington map drawn and then get consensus around it, that there will be some challenges around those people on the outside looking in.
Mhm.
That will be at least have to be addressed. But from a geography is in and of itself neutral, right? If you draw geography and you using the map to draw the City of Wilmington, it could be more objective than doing something like electoral districts, which could be viewed a little bit less objectively, depending upon who you talk to. So, of course,
Yeah.
there are going to be neighborhoods inside of this drawing, and I think a further discussion around the breakdown of neighborhoods and being able to isolate them again, and tagging individual students
Mhm.
with this geography so that they can be aggregated and counted, and then analytics can be derived based upon that analysis. It will be key. Are there any other thoughts around defining the City of Wilmington that we have not considered to this point?
I think one interesting point in the who are the Wilmington students, I note the second bullet, like prior to DSEG, what was, how was the City of Wilmington defined then? And I think I saw in the chat, Kelly or someone put, did they use straight up zip code back when in 78, when DSEG hit, or was there a different definition of the City of Wilmington? Should we be looking back at that if we're going to ultimately compare apples to apples over time and the impact education has? Is that something that needs to be considered, or do we not go that route with this discussion? Ray, and I throw that back to you because you mentioned this slide here and this, who are the Wilmington students? Would that not capture every student that we're looking right now? I mean, I don't know. It was an interesting point. I mean, I don't want to make it more complicated than it needs to be. It might be very much just the same geographic bounds of whatever it was then versus what it is now.
It may be worth, to Representative Williams' point, going to the Department of Elections, getting a map, getting the City of Wilmington highlighted on that map, and then overlaying the zip codes
Okay.
on top of it in one picture, and overlaying the electoral districts in a second distinct picture. So
Okay.
both pictures with the City of Wilmington highlighted or outlined, and then having an overlay with zip codes and an overlay with electoral districts, and maybe even a third overlay with neighborhoods, and kind of see those three pictures,
Yeah.
And see if they tell the same story.
Yeah.
If all three of them tell the same story, then I think the consensus around geography is good. If upon looking at those three pictures, you get different stories,
Yeah.
there may be a deeper dive to explore.
Haley, make a note that could be a homework assignment for the next meeting, if we can get somewhere any of that information to share with the group, if that's feasible. I think that's an interesting approach, Adrian. I think that does help.
Yep, got it. We might have some of that stuff from
Okay.
week times too. Yep.
Okay, great. All right. Ray, did you have anything else? Any other comments regarding the city of Wilmington question for homework?
I don't know if you want to respond to the other questions around programs being included. Again, it's student driven.
Correct.
So once the geo is boundaries are solidified, then the residents, whether they're in pre-K through grade 12 that reside in those boundaries, will be included in the data set. That's my distilled interpretation of what we're talking about.
Yeah, I agree.
I agree.
We are not producing a map with the city of Wilmington overlaid with school district boundaries. That is not what we are doing, which is why I explicitly left it out of the 3 views, right?
Correct.
So this is not about which schools they attend. It's about who's living there.
Correct.
And wherever they attend is wherever they attend. So I think those 3 pictures should give us enough to see, to build consensus or to see differences and address those differences as such.
Yeah. Dawn, you had a comment?
I do. Thank you, Dr. Mentor. So I'm the person who shared that information, and the reason shared it for several reasons. But I want to point out that we have, because of funding, because different programs are administered by different departments. So we have data that lives within DOE, for example, Reading ECAP. But then we have data that lives outside of DOE. It might live at DHSS or DSCYF, most likely DHSS. And a challenge, I've been on, I don't know how many meetings where we talk about a challenge of really having clean data, because children who are enrolled in eSchool have a student ID, but children who are DHSS have, I guess their MCI, is that correct? They're given at birth. And so they're born in Delaware. And so what really a challenge is that a child could be counted multiple times, because the child could be participating in home visiting with parents as teachers, which is under DOE. And then they could be participating in, there are multiple home visiting programs under DHSS. And so the same child could be participating in 3 different programs. They might get counted 3 times, but it's one child, because the numbers don't, because the student ID and the MCI don't communicate, or it's not easy to translate MCI and student ID. And so I feel that it's really important for us to look, because home visiting is a really is a focus area for us with Reading. We understand the importance of home visiting. Home visiting is critical, yet the data, some data, because it's housed at DOE, we can count the children who participate in parents as teachers because it's housed at DOE, but they're not given a student ID. That's a question for another day. But then all the children who participate in home visiting under a DHSS program, do we have an accurate count? Can we accurately say how many children who reside in the city of Wilmington are benefiting from home visiting programs in Early Head Start and in Nurse Family Partnership? I would say that based on the preschool development grant, we don't have accurate numbers. We don't have accurate data. It's the same thing for WIC, because children are not registering for a program. So I feel like when we look at our city of Wilmington data, we have to figure out a way to look at all that's happening in birth to 5 to prepare children for kindergarten, because we are in Reading focusing on that, what happens before they come to kindergarten or preschool. So how do we, I don't have an easy answer, but how do we ensure that all this data is captured for children who live in the city of Wilmington? Because that informs the work that we do, whether when they enter preschool and when they enter kindergarten through 12th grade.
So Dawn, I've got a few answers for you, but I don't have all of them. Part of it becomes an essence of uniquely identifying a student first, and then connecting that student to all of the services they receive. They're 2 distinct problems, both of which need to be solved. There on the unique identifier front, I think we have more good news than bad news, as we are constantly looking for ways to make sure that children who are receiving education services, whether they're in public settings or private settings, are getting a unique identifier. Public settings or non-public settings. I think it may be better, maybe I use better vernacular here. So whether they're in public settings or non-public settings, DOE is looking for ways to make sure that we uniquely identify the student and do not double count that student if they transition from a public setting to a non-public setting. So that is a challenge of ours. DSC has that same challenge because they're an education services provider. Now, as it relates to services from, and Representative Williams, I see your hand up, so let me get this out and then I'll turn the floor over to you. As it relates to services that children receive that are non-education related, they have the same task, and that is to uniquely identify them and not to double count them. When it comes to there are a couple of touch points between agencies such as the Department of Education and DHSS where we tackle this problem of counting a student once and not counting them multiple times. I think as we investigate this further, we will have to decide how many students are we actually missing. It will be a question to answer, a question that data nerds in both agencies can I think, hone in on, but it is something that each of us individually are trying to tackle so that we don't lose any children along the way. So let me stop there and turn the floor over to Representative Williams.
Yes, so actually Dawn and I have been on many calls about this topic because we're working on the Delaware Smile Check program, and we've ran into this issue with the DelVax and DOE and public health having different numbers. So what we were talking about, and we just actually had this conversation last week, is about, is there a possibility of giving every child that is born and that enters into the educational system or public health or DHSS, or when they need assistance from the state, giving them a student ID when they're born? So that student ID would follow them from the time they're born all the way through 12th grade. And that way, if they were to need assistance through DHSS or DOE or some other program, they would use this number, the student ID number, that would follow them through their entire life cycle, at least through 12th grade. And so I'm sure you've all heard of Data Service Center. We've had calls with Katie, and this is a conversation that we need to have with DHSS and DOE to see if we can work this out, because there are student ID numbers, as Dawn said, and then there's the MCI. So we are continuing to have these conversations. Do we have a solution? No, but it is something that we should really focus on, because it will bring so much really relevant data that we could use for so many agencies in the state of Delaware.
Yeah.
Yeah, just know I've been privy to a couple of these conversations over my 20 years at the department. It always comes down to which service is an individual receiving first. Most argue that education is not the one, health services is. And so they were wondering if the MCI number could be the master number as opposed to a student ID, which they may not receive until they're 18 months, anywhere between 6 weeks and 5 years old. And so I agree with you, Representative Williams, there are lots of conversations going on. The counter argument to that conversation as to whether or not education should be the agency providing that unique identifier as opposed to health is the sticking point that conversations that I've been a part of have always stuck on. But your point is a valid one. Getting a unique identifier that would follow that individual from birth through the many services that they are going to encounter is something that we're looking to try to tackle here.
So Adrian, I'll use your words against you. Adrian, there should be no roadblocks to this discussion. You're not allowed to say that. What's wrong with you? Did you
That's
just
right.
say there's a challenge in front of us?
I did say there's a challenge.
That's not appropriate for this
That's
point in
right.
the discussion.
Nurses make the worst patients. Data analysts make the worst data collectors. in some
Just,
ways.
I feel like you said that to me only a few minutes ago, so I figured I would bring that back.
Touche. That's a very good point. Touche.
So I do think that these are great points at the early, birth through 5, this identifier creating, a need to kind of spend time with that. Perhaps as the data sets tease out in your further discussions with Katie, there becomes another gold line that is that line, and then it does require a different look. So I think it's great to bring that up at this point.
A good tie-in, Dr. Menzer, is that in the organization of the data that you've requested from last meeting that Haley showed you a sneak peek of, the categories help us identify areas where this kind of challenge would need to be explicitly overcome, right?
Yes.
In the academics area, no. In the discipline area, no. Those are all education-specific categories. They all have student ID numbers. It's in the families and in the other opportunities potentially where so the organization of that data will help us identify potential areas where this will be a challenge. And as that area grows, the challenge grows.
Great. Yeah, good point. All right. So Adrian, to the point of what the task at hand was defining the city of Wilmington, I feel like the room is kind of agreed this notion of bringing these 3 templates in and kind of overlaying them next month to kind of give us an idea of where's going to be our consensus around the definition. So I think that's the path forward for that question. Dawn and Representative Williams and Ray have shared some thoughts around birth through 5 and some possibilities there in the chat that Haley will be able to hopefully capture up and just pass along to you as anecdotal as you look at the next pass at the spreadsheet, so to speak. I think does that. I'm not sure the agenda. Haley, did we have any other? What was our next agenda item? I believe.
No, the next is just our next meeting date.
Okay, so we do have our next meeting date. I do want to. We do have a time for. We'll do public comment here in a minute, but before we get to that, Ray, was there anything else on the agenda that we missed that you want to add in? I feel like we hit everything that we talked about earlier last week. Okay. All right. Dr. Harrison, I see you in the house tonight. It's a pleasure to see you. Rocking the bow tie and all. It's good to see you. How are you doing?
I try to rock the bow tie. My apologies. Again, it is really hard for me to escape clinic before 5 o'clock. And so
we wanted to ask you that. If we give enough, would there be a better time for you for the next discussion? Like, I know we have on here 4:30 to 6.
Yes.
But because we do, was your baby early on with Adrian and talking around this with, Dr. Payne, do we want to consider starting the next meeting at 5 and going just 5 to 6 and being real efficient, or 5 to 6:30, so that you can be a part of the discussion? Because I do feel like this is something that you should, pick the schedule around you, but we're the founder of this.
I'd say no. I think I just captured the thoughts that had already been swirling in the room. And with Yasser, we just clarified some of that. So okay. I want to be here. It's hard for me because to change my patient template requires 8 weeks out. No. And so even when it's scheduled for 4 weeks, I can't change my template unless it's 8 weeks out. So
what we'll do is how about this? We can put the data discussion starting at 5, and we can handle all the other business leading up to that. So that way, if you're able to make it, you're fresh for the conversation.
Okay,
How about
and I'll jump in right at 5. I'll just
Okay.
knock
All right.
off and be there right at 5.
Great, that would be awesome. All right.
Awesome.
That said, do we have, Haley, did you receive anybody reach out to you for public comment?
Nope, not yet.
Okay, so if there's anybody who is on the call right now that would like to make public comment, if you could raise your hand or signify in the chat that you have a comment to share. I think Adrian, I'm going to model my date going once, twice, 3 times. There we go. That said, I think we finished up in a half hour in advance. Ray, did you want to usher in the beautiful sunlight out there at 5:30, which is crazy, and it's gonna.
Is there a motion to adjourn?
So moved.
So moved and seconded by Representative Williams. All right, all. We'll see you next month on the 11th.
Take care,
care.
everyone. I'll see you then.
See ya.
Bye.